I'm Dr. Timothy Johnston. These are your post-op instructions for an uncomplicated or straightforward extraction. The first thing is you left the office with some gauze in your mouth putting pressure on the extraction site. You want to keep that in place for the first couple of hours, but change it every 15 to 20 minutes. That's creating a pressure bandage so that the blood doesn't come out, obviously, and also to keep the gums contained and pushed down where they belong so the healing can start. The other thing you want to be doing for the first couple of hours is applying ice to the area. We're trying to control inflammation. By controlling inflammation, you won't have too much soreness the following couple of days. So apply ice on and off. You want to put it on for about 10 minutes, off for about 5 minutes, and do that repeatedly for a couple of hours, the same time frame as what you're doing with the gauze. At the same time, today, you want to maintain cool, soft diet. In other words, don't have a bowl of hot chicken soup, don't drink hot coffee, and don't start rinsing with warm salt water, not yet today. Today it's all about cool, soft foods. Now going into tomorrow, if you want to rinse your mouth out with something, we encourage you to use just regular warm salt water rinses, a glass of warm water, a couple of shakes of salt. It doesn't have to be like the ocean. Do that to help rinse and keep the stitches clean if there are any, or just to help rinse any food debris out of the extraction socket. Today, again, going back a little bit, no sucking on straws, no spitting forcibly into the sink, and certainly no smoking. 2 reasons. Number one, you're drawing in on the cigarette and creating that suction action in your mouth. All of those things will make the bleeding start up all over again. But also, smoking inhibits the oxygen carrying capacity of your red blood cells, and we don't want that. We want the oxygen to get in there and start healing it as best we can. So again, today, go easy, keep it cool, keep it soft. Tomorrow, go back to warm salt water rinses, that'd be fine. Go ahead and eat fairly normally starting tomorrow, just avoid that area a little bit. You can also start brushing fairly normally, although gently, around the area that's right there. You can also floss most of your mouth. This might be the only time I'll tell you not to floss anywhere though. Avoid flossing right next to the tooth that you had extracted just for a couple of days so that you don't irritate the gums. If you have stitches, then go ahead and, like we said, rinse with the warm salt water rinses to keep those clean. Those are likely going to be self-dissolving stitches, and you can expect those to go away in a week to 10 days. If they become really irritating from a hanging thread or something, then feel free to give us a call. Come on in, we can clip that out a little early if need be. 2 things to know about as well, sort of add-ons. If the bleeding doesn't seem to want to stop, if it's been a couple of hours, you've gone through your gauze and it's still kind of oozing a little bit, take a tea bag, black tea is better, but green is okay. Dip it in some cold water, wring it out, and put it where the gauze pad was, and bite down on that for half an hour. The natural tannic acid in tea leaves helps to promote a blood clot, and that fixes almost everybody. If you're taking blood thinners like warfarin, Coumadin, or even just an aspirin a day, that may be your best secret. We don't usually have people come off of their meds for blood thinning just for a simple extraction, so that might be something you'll need to do if you are taking those meds. The second thing is, speaking of meds, we generally don't prescribe narcotics much anymore for simple or sometimes even complex surgeries. We have found this combination to be a much better solution for pain management, and that is to take 2 extra strength Tylenol, that's 1,000 milligrams total of Tylenol or acetaminophen generic, along with, at the same time, 600 milligrams of ibuprofen. So that would look like this. It would be 2 Tylenol and 3 Advil, all at the same time. Now you're thinking that's an awful lot of medication, Dr. Johnston, and it is, but the Tylenol is cleared through your body through the liver, and the Advil or ibuprofen is cleared through your body via your kidneys. So it's totally safe to take together for a few days. And the synergy between the Tylenol plus Advil all at the same time is kind of like 2 + 3 = 10. I've had many patients tell me that they've avoided taking their Percocets or Vicodins and just done that little concoction of over-the-counter meds and done much better with pain control afterwards. That's your instructions for a simple extraction. If you're having any issues, please call the office so that we can take a look at it. Thank you.